Hi, this is Dr. Sham. I am a rheumatologist from Chennai. So, yesterday we saw about the conventional drugs, the traditional drugs, which have been there for years. See, post 2000, definitely the management of rheumatic diseases, in particular rheumatoid and other arthritis, has literally been revolutionized. Now we have a lot of new molecules. So, one is called as biologicals. Many of them are usually injectables. Now we have called something called small molecules. They come as a tablet. See, remember, most of the patients, if disease is identified early and treated properly with the conventional drugs, like I discussed yesterday, something like a methotrexate, hydroxychloroquine, then they do very well. But some people, in spite of doing that, they might have an active disease, or some people might be presenting late for so many reasons. Then also the disease might be active. In those cases, 6 months as per guidelines, or at least after a year, we have to escalate from the tablet to the next level. See, again, easy example I'll be trying to give is your sugar is 300. I'm giving a tablet, it comes to 200, but it never goes below 200. Most of us know it should be around 100. So even though we are taking a tablet, the sugar is not getting control. No point in continuing the same tablet. Definitely, we have to add a tablet or go to insulin. Same thing in rheumatoid also. We are taking the conventional tablet. It might be a single tablet or 2 tablets or 3 tablets. If you are not able to control the disease activity, definitely we have to go in for the next level. Either we call them as biologicals or molecules. See, again, in this, another important thing is, ideally, like all other rheumatoid medication, these also have to be continued on a long term. In Western, either they have an this one, what you call, either it's a government funded, or they will have an insurance cover up. In India, as of now, still those things are not very robust. So many times patients have to pay from their pocket. These are newer drugs, so still they are a little bit costlier. Of course, day by day the price is coming down, but still as of now it's costly. It may not be affordable for everybody. So here we are forced to use like a troubleshooter. Like patient, we are not able to control the disease activity. We give it for a period of 3 to 6 months, bring down the disease activity, and again try to control it with the tablet. That's what we use practically here. Second thing many of them are worried is about the side effects. See, always remember, whether it is the conventional drugs or this one, if you are going to use it at a proper dosage, there is a chance that it can suppress the immunity. Because autoimmune diseases like rheumatic diseases, we know that the immune system is in excess, acting against our own body. So any drug which we are going to block that immune system, there is a chance that our immune system might be a little bit suppressed. So there is a chance that we might have a risk of infection. So usually we will be careful. We will screen for certain diseases like tuberculosis and other things. But in spite of which, particularly in a crowded country like India, there is a chance we might land up with an infection. This is a risk we should remember. I won't deny that there is no risk at all. As I told, all the drugs will have a risk. So this is something we always discuss with our patient. But as I told, since we are using these molecules for a short term in India for other reasons like cost constraints, luckily in those 3 to 6 months, we don't see many patients having infection. Maybe there are some patients whom we use it on a long term, then definitely we have to keep watching out. Depending on the type of molecule, definitely you have to watch out for the type of infection. So remember, one of the common side effects which I will be worried more than the organ involvement, because that I can control by doing a regular test monitoring. The only thing which we won't be able to control or not under our control is there is a risk of infection is there. So definitely we have to watch out for, depending on your tablet or injection, discuss with your doctor. Maybe there will be a later video where I will be touching upon vaccination. But remember, if we are not able to control with the tablets, now we have a whole armamentarium of a very good this one. There are many times these tablets, like patients who have come literally bedridden, they will be able to walk with these treatments. So in patients where it is needed, particularly if disease activity is more, or if patients present late, then we think of biologics. Again, it's not in everybody, it is only a small proportion of patients. If the patients we are going to catch them early, we can very well manage with the conventional drugs. But remember, we have newer options, so they have to be used when it is really necessary, and discuss the pros and cons with your physician and then take a call. Thank you.